Hello, my name is Thomas Carr, and I am the Information and Communications Manager at Healthwatch Manchester. I'm here on behalf of the Manchester Men Speak Up and Manchester Women Together forums to talk about World Heart Day, which is coming up on the 29th of September. I have a fantastic guest to talk with today. It's Ruth Goss. Ruth, would you like to introduce yourself?
Hi there, I'm Ruth Goss and I'm a senior cardiac nurse at the British Heart Foundation.
Fantastic. Well, we'll get right into it then. So, Ruth, can you tell me a bit about who you are and what you do at the British Heart Foundation?
So I'm one of a member of the cardiac nursing team at the BHF, and one of our roles is to help answer public queries and concerns about cardiovascular diseases through our heart helpline. And people can contact us via our free phone, via email or on live chat, and we can discuss lots of concerns that people may have about cardiovascular disease. So that can be understanding medications and their side effects, ways to improve their lifestyle, understanding test results, or if they've got a new or existing diagnosis, questions around that. That's a really big part of our job. And the other side of my job is we help support the BHF with sort of press work, and we can act as spokespeople to talk about all things heart health. And we also help internal teams with the clinical accuracy of patient information and sort of marketing documents. So it's a really varied role, but we do just focus on heart health, cardiovascular disease, all things heart is really at the centre of our job.
Well, it sounds like a very important role, and I really appreciate you being here today to talk to me about this. You clearly have a lot of knowledge and understanding of this topic. Moving on then, what is World Heart Day and why is it important to recognise this awareness day?
So World Heart Day is worldwide. It's an annual day and celebration held on the 29th of September, which aims to sort of increase public awareness of cardiovascular disease. So that can be from prevention, how we manage it, the impact it has, and it just really gives us a good opportunity to start bringing up conversations and getting people to think about their heart health, or to talk to people who they maybe know have been affected by heart disease, and just use those stories and the research that we help fund at the BHF to kind of raise that heart health awareness to try and ensure better heart health for everybody.
Fantastic. And moving on from there, then, it kind of linked in with this next question, but what are sort of the main causes and lifestyle factors that increase a person's chance of being diagnosed with a cardiovascular disease or something similar to that?
So cardiovascular disease is really broad. It covers a lot of conditions. So it could be something like coronary heart disease, which is sort of the narrowing or blockage of blood vessels, which can lead to heart attacks and strokes. Or it can be problems with like the structure of the heart, if you have problems with your heart muscles or the heart valves, or you can have problems with sort of the electrical pathways, sort of arrhythmias, so atrial fibrillation, these sorts of things. The main causes of cardiovascular disease are also varied. There are sort of modifiable and non-modifiable risk factors, so ones you can change and ones you can't. So the ones that you can't change are sort of age, gender. As we get older, your body and your heart gets older, and it doesn't necessarily work the same way as it would when you have been younger. So we know that as people age, they may have a higher risk of developing cardiovascular diseases. But these modifiable risk factors, so like your lifestyle choices, those are the ones which we really want to highlight for people to try and take charge of, and just see how their lifestyles may be impacting their day to day. So that can include whether they smoke or don't smoke, what their diet's like, how much exercise they're taking, if they're able to, and if they've got any other medical conditions which can increase their risk of having cardiovascular disease. So some of those risk factors can cause things like high blood pressure and high cholesterol, which can be cardiovascular conditions in their own right. They're sort of both a risk factor and a condition which would need some management. So what we want to do is be aware of what we can do on the day-to-day can stop us from developing these other risk factors or conditions like high blood pressure, and then really just taking those steps to reduce like the long-term impact these conditions can have. So even if you can't change all your risk factors, there are steps that you can take to reduce your risk, and we really want people to just have a think about that and what changes they could make.
Fantastic. Well, you kind of touched on it there a little bit in terms of the lifestyle choices and lifestyle factors that can impact your chance of developing a disease like that. It kind of links into my next question, where it's sort of how does cardiovascular disease and other heart-related illnesses, how do they affect a person's lifestyle?
So it can be really difficult to be diagnosed with a cardiovascular disease. You Particularly if it's come out of nowhere. A lot of these conditions, sort of high blood pressure, you don't know that you've got it until you sort of get your blood pressure checked. But once you know what to look for, and once you have that diagnosis, then you can start making the changes. So people may have physical symptoms. So depending on what condition they have, they may feel more tired when they're exercising. They may have chest pain. But also with that diagnosis comes with like the emotional impact and the emotional challenges, like, oh, I've now got this condition. Does that mean what's going to happen to me next? What's going to happen to my family? But these conditions, what's important to remember is a lot of these conditions are increasingly manageable because of the advances in treatment and lifestyle guidance. So even if you get a diagnosis of a cardiovascular disease, you can adapt to it. You can get that support with the sort of emotional side of things, and also the support to make some changes. So if you don't take a lot of exercise, we can help you do that. Or there are places, there's organizations that can support you with that. You may have to stop driving temporarily, but you can speak to the DVLA about what that means for you. Importantly, it's that early detection and proactive management, so guided by your healthcare professionals, can really help support and improve your outcomes. The earlier we know about something, the earlier we can take steps and sort of reduce that impact that cardiovascular disease may have in your life. It's not to diminish it at all or not say it's a big deal. It's really frightening for people because it's your heart and you worry about your heart health. But with the right approach, people living with cardiovascular disease can have a really healthy life, embracing new habits, and get that support with their physical and mental well-being.
I think it's so important to talk about both the physical and mental aspects of heart disease, and it's great that the VHF can support people in those ways. It's a really important thing to recognise, especially in the current climate we live in. You sort of touched on my next question already, but what symptoms should a person look out for if they believe they're at risk of developing this kind of disease?
Sure. So the symptoms will be different depending on what condition that they may be linked to. But if you are, the first thing I will say is if you're concerned about any symptoms or something that is different or new for you, then go and get that checked out. Places like our website, the BHF website, and NHS websites are really good sources of information just as a starting point. If people are worried about their risk and they're certainly over the age of 40, they may want to think about having their free NHS health check through their GP practice, which will help identify the earlier signs of heart disease and stroke. Or you can just talk to your local pharmacist or just make an appointment with your doctor saying, I want to talk about my risk. On the slightly scarier side of things, it's knowing those symptoms. So knowing what are the signs of something like a heart attack. So just to use heart attack as an example, symptoms, people will know what the symptoms are. It's chest pain, people grabbing their chest. The most common sign is sort of a pain and discomfort in your chest that happens suddenly, doesn't necessarily go away. Other people may feel sort of a pain that spreads down their left or right arm, to their neck, to their jaw, to their stomach. They might feel like it's more of indigestion. Some people, this pain is really severe and it stops them in their tracks and they can't do anything. But for others, it's a bit more gradual. You may also feel sort of sick, sweaty, lightheaded. So if anyone feels this way or has these sort of symptoms, then you should call 999 for an ambulance if you're suspecting you have a heart attack. If you're having sort of chest pain when you're exercising, or you're feeling more tired, or you're feeling more short of breath when you're exercising, something that's different for you, these are sort of symptoms as well, which may possibly say that there's maybe something going on with your heart. It's not a definite. These are just some of the common symptoms that we know about. So if you're starting to experiencing them, or someone you know has, or you've been checking your blood pressure regularly and you're noticing those numbers are going up or they're significantly different from usual, those are the sort of sign and symptoms that would maybe just ring a bell and tell you to go and get those checked out, just to see if there is anything going on and action can be taken if there's something that needs to be done.
Fantastic. Well, thank you for giving that information. I'll put it in the description of the video as well, and I'll put some links to the BHF website in the video as well, so people can find that if they need it. And the last question for me before I wrap up today, in my research before this interview, I found the British Heart Foundation cardiovascular disease fact sheet online, and it had a really interesting stat in there. It said that 7.6 million people, or over that, in the UK are living with heart or circulatory disease. What does the BHF do to support these people?
So the BHF, we've been at the forefront of helping to save and improve lives for over 60 years for people who have cardiovascular disease, and we've helped have annual cardiovascular deaths over the past 50 years. And we have a new strategy, which is highlighted 3 key priorities where we want to sort of reimagine prevention. We want to try and prevent some of these conditions happening before they become a problem. And that can be through advances in how we do data science and artificial intelligence. We want to increase investment into cardiovascular research in the UK and make sure that health systems are radically improving care for people with heart conditions. We want to see these numbers going down. So as well as continuing to fund like this groundbreaking research and campaign for better prevention and care for people affected by heart and circulatory disease, we also have our heart helpline and our information and support offering, which has booklets, guides, support groups, and all of this is available on our website. But none of this work that we do would be possible without the incredible generosity of our donors. So this World Heart Day, consider supporting us and helping us make this life-saving research and care possible, whether it's donating, having a clear out and donating to our shops, or taking part in one of our fundraising activities. We really are very thankful for all the support that we get so we can continue to do our job.
And I'll put all that information in the description. I'm sure I'll be getting involved in that and helping you guys out where I can. That's the end of the interview today. Thank you very much for being here, Ruth. I really appreciate your time. Some really great answers there and some really useful information that I'm sure people will find helpful.
Thank you so much for having me. It's a pleasure.
Thank you very much, Ruth.